The Youth Care Project is an adolescent and youth-focused project with particular interest in advocating for sexual, reproductive health and HIV self-care practices, especially for young people living with HIV. The project aims to increase access to digital self-services and commodities as well as adoption of the self-care practices by the Ministries of Health in Kenya, Zambia, and Tanzania. The Youth Care Project is funded by AIDS funds and is being implemented by 9 consortium partners, which are ARASA, Ambassador for Youth and Adolescent Reproductive Health Program, AHAREP, Children's Dignity Forum CDF, Network for Adolescents and Youth of Africa NAYA, the National Network of Young People Living with HIV and AIDS in Tanzania NYP+, Pediatrics AIDS Treatment for Africa PATA, Global Network of Young People Living with HIV Y+ Global, and Copperos Zambia CRZ.
With this program, we've been able to reach out to over 100,000 young people across the country in 2 provinces with around 10 communities, around 10 healthcare facilities. What the Youth Care Program has done for us is it has enhanced some of our work in our health and well-being portfolio. We've been able to get lessons that we've taken on even beyond the program. For example, with the Youth Care Program, we did a research on peer educators training. And one thing we were able to find is that only 10% of trained peer educators are retained at health facilities, especially urban health facilities. So with our lessons from the Youth Care Program, we are now rolling out an on-site training as opposed to a full-blown off-site 5-day training. And that has helped reduce our costs of training by almost 40 to 50%. This also improves peer educator retention, because what this means is health facilities can continue training these young people at their own pace at the health facilities at a reduced cost. The Youth Care Program has laid the foundation for 3 more programs which have been built onto the Youth Care Program. We have a Kids to Care program, and we have the Zambia Integrated Health, who is using lessons from the Youth Care Program, and we're implementing in more than 2 provinces across the country. So this project has had a ripple effect, which is ultimately going to see more than 400,000 young people benefiting from a program which was only designed for 100,000 young people in Zambia. The Youth Care Project has improved our engagement with stakeholders in various ways. First and foremost, the Youth Care Project, being in health facilities, allows us to interact with community leaders around the health facilities as well. So what we have seen is we have seen an increased community level buy-in at our facilities and at the communities that are surrounding these facilities. What the program has done for us is that it has allowed us to provide continuous technical assistance to government over the last 3 years going into the 4th year, which will have longer term impact as opposed to just a standalone program on its own. Another benefit of the program has been in improving our relationships with stakeholders. Through many platforms like the technical working groups and other steering groups around the reproductive health scene, we've been able to connect with other partners and have joint efforts towards many different initiatives. One example is that the Youth Care Project has supplemented the regional adolescent health endeavors and many other platforms for young people, which is a testament of the benefit of the program when it comes to stakeholder engagement. So with the Youth Care Program, we've been able to improve our relationship with stakeholders and create a platform for dialogue between young people and various policymakers. With the program, we've interacted with district commissioners, with ministers, and many other policymakers.
The 4-year project began in 2022 and will be ending in 2025. The Youth Care Project empowers peer educators within implementing health facilities, providing them with logistical support to conduct outreach and awareness activities in marketplaces, churches, schools, and through door-to-door sensitizations. The project also works with community leaders as community-based volunteers. The cadre of community-based volunteers includes, but is not limited to, teachers, healthcare providers, journalists, counselors, religious leaders, market masters, parents, police officers, and bus and tax association leaders, among others. The gatekeepers lead community dialogues with parents, guardians, other community leaders, and all adults on the importance of supporting adolescents and young people to access sexual reproductive health and HIV information, commodities, and services.
The Youth Care Project has helped me to expand my networking capacity and also get to groom me, impact me with skills that I'm able to use right now. So my networking abilities are more of interactive, and also I'm able to socialize with other people, and of course with the healthcare providers in almost 10 facilities that the Youth Care Project is being implemented on. Then secondly, I think my skills are more advanced right now. I've gained skills, especially the public speaking skills, and also I've learned how to deal with issues that young people face in the society. As peer educators, we've got outreach activities that we mostly conduct almost each and every week. So with how we handle it, we go out there as trained peer educators. We go to sensitize sexual reproductive health information to our fellow adolescents, because these are our target audience. We receive condoms, brochures, and posters that we use to disseminate information in the community. So sometimes we've got door-to-door outreaches, and sometimes we've got facility outreaches, and overall we've got the community outreach where we just go and speak to young people individually. So when we go there, we assess them, and we also ask them what they would want to learn, and sometimes we could facilitate information that is of their interest. We also have invitations that we give out to them. We give out invitations so that they can come and join our youth-friendly space. Before the Youth Care Project came, we had a lot of challenges in form of we had no materials, no resources for us to run our day-to-day activities. I'm talking about the refreshments, and I'm also talking about the IEC materials that we are supplied with almost each and every week from Koparo Zambia under the Youth Care Project. So it's a good project and a good initiative that has helped us, especially as peer educators, to go ahead with our everyday activities.
Tubombera pamo nama pastors fellowship ukutungirira iyi program ku bana kusabankanya mu churches. Nalikwata yamaka yakupita okulanda mu churches bonse bali ama pastors tungabombera pamo kwa fano kuleta ba youth pamo no kubakansha bakweba ati tuishwe fe twalaikala mukatika musumba no kuchinja mbera shaba no kulingana na masambirisho ayeso kufuma ku youth yayo ifwe bafya state tube batinga balesango akulya kuti basambirira no kukampuka mu finto ifwe bafya state tubebe ifwe balesambira kulya ifwe kuti ba influence nyangu ifwe bafya kuti ba influence nisha kubeba abana namanga balesango ku youth friendly kulya ndo tureba ko seresha tulesango apo no kubatungira ngama churches ngafwe basunga kuno kutu atashale spozi imyosha abantu abengi. Okay, bamwe abana nabachinja tabari ifyo bali nabachinja ero tu nembera shimuna shinja ko kukira ili otakwali kusambirira muri umsango bale sambirira mukakiretu afana kuba nabo ndio bale kumana bale yafwako abana abo kusambirira mu mberesho bafire baendera mu ngefe bale sambirira mu youth friendly. Echo ningate mu kulunda po chimbi kisuma chako bati amalwele ayengi na achepa fire kwale bokulwala lwalo mulando kwati bale sambira amalwele ama utuswende mabola bola fileta fire umfika nomba mulando kwati bale sambirira na beshi bobukankala ubwaba mukubutukira kuchipatala no kumfwa amasambirisho alenga kwati amalwele ayengi bati yala bakwati yala achepa pantale umfika sana ifu chali kali kunu mokutwafuni.
The Youth Care Project works hand in hand with ministries of health in Kenya, Zambia, and Tanzania, complementing their efforts while partnering with policymakers and stakeholders at national, provincial, district or county and community levels. In Zambia, the Youth Care Project has received support from Parliamentary Caucus on Sexual Reproductive Health and Parliamentary Caucus on Child Protection, as well as local authorities in Lusaka, Chilanga, Kitwe and Kalalushi districts.
The Youth Care Project is a very important project to this country because it's empowering youths, the animators, the ones who are in the health centers, who are reaching out to other youths. For example, they are taking a very good message to other youths, holding focus group discussions, sensitizing other youths on the dangers of HIV/AIDS, and also access to reproductive health services. So this project is empowering our young people to make to access services and the correct services, and also to do things in a correct manner. Even us as parliamentarians, we are benefiting from the capacity building because we become more knowledgeable and aware, so much that we can give correct information to our citizens, because we are a resource in our communities. We are a resource. We receive phone calls every day about different kinds of issues. So when we are capacity built as MPs, then we are able to give the correct information that impacts on our communities. So it is a very necessary project which we would want to continue and to extend to all parts of the country.
This project has really helped a lot in our district and the community. There are a lot of activities that they've been doing. When you look at adolescents and our youths, they go through a lot. And having an organization that comes to embrace the youths and the adolescents is quite a big blessing. These adolescents that we see, they are coming from a home setup, a household. And if we empower the families and the community at large with these sexual reproductive health issues, then they will be our ambassadors. The youth care has trained our adolescent focal point persons in some of the things that I've already mentioned. Adolescent health is one of them, mental health, and also the sexual reproductive health. We had the training also to target the peer educators so that they can be CBDs or community-based distributors. These will actually be helping with the provision of contraceptives in the communities to our adolescents. They help our focal point people with mentorship just to make sure that they're doing the correct things. They provide with the logistics for us to reach out to the community, and we also integrate with the schools sometimes. So you find that when there is school health project, the adolescent focal point people are the ones that will actually take the lead to engage the schools and also to give health talks to the pupils.
With technical support from ARASA, PATA, and Y+ Global, Copperos Zambia and other youth care consortium members have been able to organize and support policy dialogues at a national level, train healthcare providers, and support health facilities improve their adolescents and young people's service delivery.
PATA is a technical partner on the youth care project, working together with ARASA and Y+ Global. So we are working with local country partners. We are working in Tanzania with CDF, and then also in Kenya we are working with NAYA and as well as IRF. And in Zambia here we have been working with Copperos, who is our local partner as an implementing partner. In terms of our role as PATA is basically to build capacity in the healthcare providers, which includes the health care provider. These are trained healthcare providers, and then we also train the peer supporters, and we train them in a number of courses. This project quite align with our goal as an organization, working with healthcare providers, building their capacity, motivating them to be able to provide quality of services, but also giving them a bit of resources for them to be able to train on-site peer educators and to be able to respond to our target beneficiaries, who are mainly adolescent and young people. We train the healthcare providers in the WHO self-care concept for them to understand what their role is, and also for them to understand what the recipient of care expect from them. But we go further to train them in what we call the meaningful engagement of adolescent and young people, how they should meaningfully engage the adolescent and young people. We also train them in how to engage community gatekeepers, how to collaborate with the communities, because communities are key for us to achieve a universal health coverage, including the self-care concept and in the project. And then we also train them in communication skills, how to effectively work with adolescent and young people. We train health providers in that. And we also train them in some advocacy, how they can do outreach campaigns, targeting community gatekeepers, targeting different caregivers and parents that are supposed to be supporting or assenting for the adolescent and young people to access services. Mostly these sexual reproductive health services and as well as HIV services. So those are mostly what we focus in as a project.